At our core, I believe we all want to live responsibly, care about one another, and keep each other safe. I'm concerned when I see people in positions of power setting one rule for the general population and following an entirely different set of rules for themselves, creating horrible division when what we need is to be uniting for solutions that work. Hi, I'm Dr. Renee Kohansky, and welcome to Episode 7 of Clinical Correlation. Before digging in, I want to take a moment and acknowledge some of the comments I have received from all of you. The thoughtful, caring, intelligent human beings willing to engage ideas outside your comfort zone. I like to think of clinical correlation as a bastion of freedom for thought, a place where I bounce the informed clinical ideas in my head out to you, my equally informed, clinically observant, gentle listeners, who then share it into a world that is sadly becoming increasingly myopic in thought. We all know everyone wants to be heard, understood, and not shut down. One might even postulate for a moment that this is a large reason our patients get better if we do our job correctly. So let me break for just a second and share some of the wonderful thoughts that I have received from you, the aforementioned listeners, because they are very, very much worth sharing. In one program, I discussed the pluses and minuses of a live exam compared to the virtual one. One huge negative in the live exam is not being able to see our patient's full face due to masks, and I was trying to work out an acceptable solution. Well, thank you, Dr. Bass-Nair, for your contribution. He writes that he asks his new patients to bring a full face and full body picture on their cell phone or an actual picture to their first session, and he has one of himself as well. Don't you just love an elegant but simple solution? Well done, Dr. Nair. In a similar vein, and let's face it, it's hard to get away from these anatomical metaphors. When discussing face masks, Dr. Blake Prescott of Newfane, Vermont, actually sought out my professional email and wrote me directly. He had a lot to say in this regard, and while I can't verify his credentials, I found everything he had to say extremely informative, and I've actually followed his advice. So let me share some of what he said and kind of paraphrase what he said. Dr. Blake said that distance is important. Well, we know this, but he actually had a lot of data to support it. A properly fitting mask, even if not so good as another type of mask, is still better than a mask that is not well fitted or slipped off. I mean, come on, let's face it. How many of us have been in our offices and basically the mask is like basically on the patient's chin? He continues by adding, wipes help, but soap and better is better since COVID has a lipid capsule. Transparent masks are better than shields and can be attractive. And also the transparent mask can help solve that problem that I was having with seeing the patient's face. Again, thank you to my listeners. I always welcome your thoughts and comments. This is exactly the discourse in which we need to be engaged. And please, please keep these comments coming. They are truly, truly gems. Well done. So, returning to my original point, the theme of division has come up so repeatedly in my practice as a source of stress and distress to my patients. I absolutely felt it was worthy of a program, and maybe even several. This is because these are the issues that are dividing us. And in fact, these are the issues that should be uniting us, and specifically around the management of the COVID virus. Here, once again, I say psychiatrists have an opportunity to shine and be of tremendous service. I ponder at the incredible irony of a world that can explore and question the binary nature of sexuality, yet allows itself to be locked into some artificial binary construct regarding a particular position of COVID. Think about that for a second. There's a lot packed in there. I'm going to repeat it. I ponder at the incredible irony of a world that can explore and question the binary nature of sexuality, yet allows itself to be locked into some artificial binary construct regarding a particular position of COVID. Let's face it, this is a complex virus literally unleashed on us and for which we have advanced light years in just 1 year. And can you believe we are actually talking about a vaccine? And yet, in many ways, we remain extremely closed-minded in our conversations with one another regarding this virus. So now would be a good time to recall what we've discussed in other programs. We can't get stuck in our own heads. Our own individual positions do not matter one iota. We are about taking care of our patients and meeting our patients where they are. Our job is to open minds to question, and question when we do see abuses. The latter, however, is not necessarily with our patients, but definitely here in forums such as these, and also in our own thoughts and contemplations, which are rich and need to be watered, nurtured, grown, not hidden from sunlight. I don't see our role as individual psychiatrists as being political advocates. I do see a responsibility to protect the most vulnerable. And this goes to the whole concept of who has power. For example, when considering issues like involuntary hospitalization and involuntary medication, we in our profession appreciate that if we are going to take away sacred freedoms and civil liberties from an individual, there had better be strong checks and balances in place before we do that. For these individuals are indeed among the most vulnerable and the most at risk, and we have a special duty of care for those most vulnerable and most at risk, and we all have always recognized this. So in this way, we must always note what is the integrity level of those making policy and what are the checks and balances, which brings me back to my open and the obvious contradiction in do as I say, not as I do. And of course, the most important point, at our core, we all want to be safe, and we all really, really do want to take care of each other. It just may look different to different people. Regardless of whatever else may be true, the basic core value of our society needs to be remembered. For the most part, because obviously there are always exceptions, people are not operating from malice. And when we remember this, that people are not operating from malice, that we are operating from a place where we want to take care of each other, where we want to find solutions, that we are all in this together, division dissipates. I don't know the exact science on masks. Dr. Blake has a lot to say, which I found valuable, but I wear one on the chance it might keep my patients safer. It does not make me morally superior. There are also valid, contrary data which offer a differing perspective on the science of masks and risk benefits. Have you read any of those? They're worth reading. You or I don't have to agree, but they're worth reading. Remember, every quantum can be described as a particle. Well, that is, except when it behaves like a wave. And the specifics of mask discussion are truly beyond the scope of this particular program, and actually is not the point. Here's what I'm concerned we've lost. It's not the content of the thought. It's forces driving us into a society that is no longer communicating. We, even in the so-called sciences, are having an inability to hear each other and give each other due respect. We've become a binary COVID world that is destroying relationship. We have to remember there is nothing unhealthy or dangerous about questioning premises. Because don't forget, who we are at core is a species that wants to be with each other, relate to each other, play with each other, and love each other. I don't question that. I have eternal faith in that. I do, however, worry about individuals determining draconian policies they don't themselves follow, creating dissent, division, and shutting down thoughtful conversation, ultimately hurting the most vulnerable in our population. This is our moment to bring forth a new kind of conversation and change this horrible, unnatural division no one wants. to remember how much we are all actually aligned in core principles of solving problems and smash open our diversity of thinking to include ideas outside our own usual thinking. I'm Dr. Renee Kohansky for Clinical Correlation.